Hi, this is Dr. Jason Hahn here at HealthFit Physical Therapy and Chiropractic, located in Pasadena, California. Today I'm joined with Chris Foreman and Paul Ledoux. A little bit about Chris. He's an ordained minister, a U.S. Army chaplain, a data and technology consultant, and most importantly, the founder and CEO of Wellness District Los Angeles. Paul here, he's a youth soccer coach, an educator, a writer and author, and he heads his own nonprofit to help underprivileged children. And I'm so happy to have you guys on board here because we've had a great relationship for the past few months. And I wanted to highlight a little bit more about what you guys do. So Chris, can you tell us a little bit more about yourself?
Sure. Yeah, and thanks for the interview opportunity and the opportunity to share about Wellness District LA and inviting us here. I really appreciate that. So a little bit about me, how I got started in the wellness space was trying to solve my own chronic pain issue. And maybe you have experienced this with a lot of clients dealing with chronic pain. And when I found out that my chronic pain could be tied to an emotional issue, that kind of opened up so many possibilities for me as far as therapy. And when I began to look into different types of therapy, like sound therapy or acupuncture or hyperbaric oxygen therapy, I said to myself, I'm not the only one looking at all of these different modalities and trying to keep track of it all. It's so confusing. It's hard to keep track of all of the benefits and things that can go along with these types of therapies. Right. So I started researching on my own, and I'm a data nerd, and I love looking at data, numbers, studies to find out if these things are proven to be effective or not. And what I found was that a lot of these different holistic and alternative modes of therapy were helping a lot of people. And I wanted to provide access to more of those therapies in one membership for people. So that's how Wellness District LA was born. We provide guided access to the best health and wellness practices that LA has to offer. So when we find places like you, we want to highlight them. We want to introduce people like Paul to your services.
Right. You've done amazing things for so many clients, and I've really appreciated our relationship. And at the end of the day, it's getting people the best care possible.
Yeah.
And then having a trusted network that actually gets results versus having the person search on their own. Because there's a lot of people out there that have been misled or, went down the wrong channels where they're just sick and tired of it.
Right.
So,
and when you find yourself in that state of pain or you're trying to solve a problem, it's hard to hear the truth, and it's hard to block out the noise. And so that's where we come in also. We try to help you turn down the noise and turn up what's true or what rings true to you and what is in alignment with your type of care and the things that you would benefit from. And we also introduce you to things that might stretch you a little bit as well, that might be outside your paradigm. But if you're not ready for that, we won't push that on you.
Right. Yeah. And then one of your clients, Paul, first of all, tell us a little bit about you and what you do.
So I teach sports to children. I have a little business in Pasadena that I've been doing for 10 years, and very active, and I play competitive soccer myself. Just recently self-published a children's book. Want to give back more to the community, so I started a nonprofit organization trying to help underprivileged kids, because sports has, saved my life and is wonderful for all children, and I feel like it needs to be accessible to all children.
Right.
So that's what I do.
Yeah, doing some awesome things in the community. And then we always know that before we can help others, we have to help ourselves first, right? So obviously you've been a client of Chris's for a little bit. Can you tell us a little bit about what you were dealing with and what led you to find Chris in the first place?
So being self-employed, and it's a small business, I don't have health insurance. So I had health insurance years ago, and the doctor, I messed up my ankle, and they're like, oh, here's Vicodin. And that really didn't help the problem. So I've always been interested in alternative medicine, like acupuncture and things of that nature. And I just, by chance, saw a flyer for he did a wellness week that was free, and it was sound bath and massages and yoga. So I signed up, I met Chris, and we hit it off, and he told me about the membership, and I've had chronic neck pain for years and years, headaches, and I've tried getting, I think it's oxygen injected into my neck and just all kinds of stuff, and nothing was helping. Massages and, you know, since being with Chris, I haven't had headaches, I haven't had neck pain. It's insane. It's insane. So this is my health insurance.
Yeah.
Honestly. You know?
That's pretty awesome. Like, what was the overall experience? Like, were you, like, when you were talking to Chris in the first hand, were you a little bit skeptical about, what is this thing? Or, like, what was the experience like?
I wasn't really skeptical. It was just more like, oh, maybe I'll try that, maybe I'll try this. And based on his recommendations, I was just like, I did them for a month, and then I was like, you know, this is working. I want to make sure that it really does help, and so I'm going to go for another month. Yeah, I don't really think that anything... The ice bath was pretty gnarly. I was skeptical about that, but, you know, anything to help promote health and, like you said, taking care of myself,
Right.
I'm all for it.
Right.
You know?
For you, Chris, and meeting someone like Paul, who has tried things before and not gotten good results, like, how do you approach those kind of situations?
I align with a lot of that frustration because I've tried a lot myself and didn't get anywhere. And I think that's most people's journey through the health industry, especially when it comes to Western medicine and medication. I myself was offered medication as well to solve some chronic issues. But how I approach it is, first of all, aligning with their emotional need. You know, what are they trying to solve and why are they trying to solve it? Are they ready to take this journey? And the best thing that we can do is help pinpoint where they are in their journey. Are you to your breaking point? Are you fed up with everything? Have you tried every single thing that's out there? And are you open to trying something new? And I think when we find those 2 points where people are in their journey, I think we can help orient them to where you want to go. It's kind of like, okay, if you want to navigate in your car where you want to go, it's got to know where you are. And so we do a lot of work to find out where they are. We send them a survey. I talk to them, find out, you know, what their journey's been like up to this point. And I think with somebody like Paul, who was dealing with a chronic issue and saying that he's a professional athlete, he's like, his body is his money source, and how important that was to him. So solving this issue was very personal. And so we have to actually look at that on an emotional level, and what is this saying to us, and how can we actually take an approach that would benefit him emotionally as well. And so I set him up with a therapist as well. Yeah.
So obviously, like, Chris is very invested in your health. How is that different from other people like you've been to?
Just this, looking me in the eye, you know, some compassion. I had Kaiser for a month, and it was just like, I feel like the doctors are looking at your chart. They don't even look you in the eye and ask you what's going on, what have you tried. Just that level of, again, for lack of a better word, it's just compassion, you know, that is really heartfelt and tremendous. And there needs to be more gentlemen like him out here, you know, trying to help people better their lives and live happy, healthy lives, you know?
Yeah, I truly feel that there's a huge psychosocial emotional component to everything that we feel. And I, as professionals or clinicians or what have not, establishing trust is always first and foremost.
Yeah.
Because if clients feel like they're misled, they're not going to trust you. They're not going to allow their bodies to receive the treatment.
Right.
Even if it's a good treatment, your body has to be in a state to receive it. So having this relationship with Chris and you and seeing this is like, it just solidifies why people going through Wellness District always, I won't say always, it's a absolute term, but for the most part, they do really, really well because people actually care.
Yeah. And I think it takes a tremendous amount of trust to get in a 34-degree ice bath.
Right.
Water. Then I say, hey, I want you to try this. I think this is something that's going to benefit you. When I say I lead you to things that are going to stretch you a little bit, that's kind of the trust factor, where I let you know the benefits. But once you do it the first time, then it's like I'm so capable of healing because I can endure something like this
Right.
for 3 to 5 minutes. Then my body's capable of amazing things, and so it's capable of healing. So there's that psychological boost that you get along with the benefit of the muscle recovery.
Mm-hmm.
Yeah.
So you've done numerous treatments. You've done cryotherapy. You've done sauna. You've done body work. Here at HealthFit, you're doing hyperbaric oxygen therapy.
Mm-hmm.
How has that experience been for you?
Just the H-spot?
Yeah.
It's been it's kind of hard to gauge how much that helps just on its own, because I'm doing so many things like we talked about before. I would go get a deep tissue sports medicine massage, then an ice bath, then come here. So it's hard to just pinpoint one thing and be like, oh, that's helped out tremendously. I think as a whole, all these things that I've done has really given me the best capability to heal myself.
Right.
And I mean, it's been amazing. Every time I come out of there, I feel more energetic and just more clear, more focused, like I'm breathing better. Yeah.
So if you could pinpoint, like, what were the main problems that brought you to seek help?
Neck pain, headaches, not very flexible, just fatigue, low energy, things like that. And I think I was in a point in my life where I was going through some emotional stuff, and I was just reaching out for anything and everything, trying new things. I've been lucky that I'm open-minded and able to say, you know what, I'll try that, I'll try this. And like I said, it was just serious dumb luck that I saw that flyer and, joined up and said, okay, I'm going to try this. And then meeting Chris, having that trust, like we were talking about, this guy actually, knows what he's talking about,
right,
and could probably help me. And if not, then oh well, can check that off. But it really did help. And I was sold on the idea that I was just going to live with headaches the rest of my life. When you live with that pain for so long, you're just like, well, this is life, and you don't really see a different avenue of recovery or hope or anything like that.
What is that? Because I think, like, you talked about your story, and we see a lot of clients that they're submissive to it. It's basically like, it is what it is. And then can you explain a little bit more about that frustration, that, like, I'm just reaching for anything, this is just not helping me?
It's a state of almost complete hopelessness. Just being like, okay, well, I'm just gonna be a man and tough it out and do what I have to do, and really not feel like I'm doing my best. Just I'm gonna do what I can. And
on the surface, when we hear from clients, on the surface they typically talk about, oh, the pain, the headaches, the soreness, the stiffness. But I think it's important to understand, like, what those things actually do to you. They affect you mentally. They take away your independence. They take away the things that you actually love to do. Right? Whether it's I want to walk with my significant other, I want to go play golf, I want to do X, or even those that aren't active, and you literally cannot focus at work. You can't get stuff done. So I think it's important to understand that these feelings of pain do much worse things to us that we don't even actually put a finger to. And to understand that is the true impact of what these things are doing, and why it's so important to find someone like Chris in Wellness District that can actually guide us to get back to where we're trying to get back to, because it's typically not just one thing. It's listening to the person as a whole and picking the right thing to do at the right time. I don't know.
My experience in the military, working with soldiers struggling with injury, PTSD, suicidal ideation, sexual trauma, it's so important to understand the pain and the root cause of the pain, and trying to help them heal the emotional and the physical as well. And then there's the spiritual component. Again, as a chaplain, I've had so many athletes and different people sit in my office, crying their eyes out because they're not who they thought they were in a given environment. So they're not as strong as they thought they were. They're not, they think they're going to be perceived as weak if they get help. And I think a lot of those mental roadblocks is what keeps us from actually healing.
Right.
Because we need to heal in community. And that's what I love about the Wellness District. It is a community of practitioners and healers. But we can't do it alone, so that's why we have to reach out. And so I love it when people say, hey, I'm ready to get help. And then we have that conversation that kind of removes some of the stigma behind what they might be feeling about their pain.
Yeah, I think hopefully Paul feels this way, but like when he's here, it's a team effort. It's a collaboration where we actually, with your permission, obviously, it's like we talk about how you're doing. Where can we tweak here and this and there, and I work for a professional soccer team, so it's like it's not just me healing the person. It's me. It's the athletic trainer. It's the doctor. It's the coach. It's the massage therapist. It's everyone working in conjunction to get this person to where they want to be, and I think that is the beauty of what you bring to the table.
Right. Yeah, I like to say I'm like Nick Fury, and I just assemble the Avengers and get the best people that I can to help you and help you feel part of that community. And every single person that we bring on board cares deeply about your healing, cares deeply about your progress, and doesn't see you as just a number. They're going to look at you in the eye. They're going to ask you, if you have a family, how's your family? How's your kids doing? Tell me a little bit more about yourself. And a lot of people aren't used to that when it comes to healthcare and wellness. They're just like, check the blog. I gave you the medication, or I gave you the treatment.
Right.
No, hope you get better. We're following up with you. We have a team of people asking about, hey, are you on supplements? Are you on this type of treatment? How can we adjust and how can we work together synergistically to produce a better outcome?
Right. I think that, like I said in the beginning, building that trust, that personal relationship is key. Like our practice, we're one-on-one. You're with the doctor the entire time. And that conversation is just as important as the hands-on, just as important as the exercise or whatnot, because you're constantly peeling layers through conversation while you're doing stuff to target the underlying problem.
Yeah.
So now that you are much better, right, in general, what is this freedom brought for you?
Just the knowledge that I don't have to settle, to go back to your question before. I didn't even think that, like I said, that I could get over these headaches, so when you were talking about walking with your significant other, my ex-girlfriend, I remember so many nights just being like laying in bed and being like, my neck hurts, I don't want to do anything. And I didn't realize at the time that's taking a toll on our relationship. Right. But it's the truth that I'm in that pain, and I've just come to the point where I'm like, I have to deal with this. It's not going away. And now knowing that I have that freedom is so, it's giving me hope.
Yeah.
You know what I mean? It's like, and case in point, when about a month in, I was playing soccer and I blew out my calf, and I was back in 10 days. And my teammates were like, what in tarnation did you do, man? You're back after 10 days. You should have been out like 6 weeks. Right. I'm like, you don't really want to know what I did to get here, but it's just, it brings a whole nother level of hope to life. Working with Chris and working with all these different practitioners. Right. And it's like, I feel almost like an Avenger, like Iron Man, that I can take on the world.
Yeah. You can actually live your life now.
I can live my life, and not just live life, but live life at my best. Right. That's crazy. Yeah. Where you're operating at your best. How many people can say that they're actually doing that?
It's a great point.
Very few
It's
people.
A great point.
But I feel like because of Wellness District, I am one of those people that is living my best life.
Awesome.
Awesome. And I firmly believe that in my heart, physically, mentally, spiritually.
When you first hooked up with Chris, what were your goals? Like, did you have big goals? Did you have like
To meet
you're like,
ladies, honestly, just kidding. No, I mean,
So have you?
Here and there, yeah.
We're launching a dating service as part of our 2022.
All right.
Yeah.
Expanding, you know?
Expanding.
Yeah, I think it was just, let me try some new things. Let me learn more about myself and different modalities, different ways of healing, different, I love to learn new stuff. I love to try new things. And it's like, I guess that I didn't really have a goal. It was more just, I was in for the experience and hopeful that maybe something would help.
Right.
And it did. If I could go back and tell myself, hey, this is where you're going to be at in 2 months, I would have been super jazzed.
Right.
I would have been like, okay, I'm going to go and do the ice bath and get on it faster, more vigilant.
What would you say to some other people that have felt the same frustrations, the same kind of situation that you have?
I have teammates that, oh, my back, my legs. I'm like, dude, you need to go try this. You need to go try that. And I think it's one of those things, like Chris was mentioning, it's hard to ask for help. And even once you do ask for help, it's hard because so many people are just trying to get by in life. They're not trying to raise the bar. They don't know, just like I didn't know, I have the capability to level up. I have the capability to go up with my physical well-being, which in turn will help out my personal relations, will help out my work relations. I was just trying to make it through. That's not really living.
Right.
That's just, maintaining. And so I feel like it's hard for people. I tell them every time I see them, I've been hyping you up. The wellness district. So, I tell people, you got to try this. It's amazing.
Right.
The proof is in the pudding. I'm back after 10 days, playing again.
Yeah, I think we see it a lot. It's most people don't stress wellness enough. It's like it's sick care,
Right.
Yeah.
not well care, right? They wait until it gets too bad, where they're really, really messed up, and they try to make a decision, and they can get back. It just takes longer, and they may not have the patience to get there. So, what would you say? That's part of it, right? You're telling your boys like, hey, this is good for you. But how do we get more people to understand that it's not about, we don't want to get that far. We actually want to be proactive instead of reactive to whatever's happening to us. Like, what would your advice be?
I was one of those people who let it get too far, and most people come to the end of their rope, but you don't have to get to that point. The moment you start to realize that you've had some pain or some trauma and that hasn't been healed, to somebody and saying, I need to get help. It's our pride that gets in the way. Oftentimes, it's often we feel like, oh, I've got this, I can handle it, or I can play through an injury. I don't want to let my teammates down. I don't want to let my family down by taking off work. What does it look like to take off work, to take sick days? And, I have things on the line and people are depending on me. So that pride gets in the way. And so things become chronic and things become, overused, and then we make the injury worse. And if it's an emotional thing, we're not even thinking about that. We're like, hey, I have this knee pain or this back pain or this neck pain. We're not even thinking of in terms of, am I being triggered emotionally? Am I not sleeping well? And I think some of those things need to be addressed right away. If you're not sleeping well, if you're not eating healthy, there's only so much we can do, but that's why the wellness district comes in and looks at all of those angles. We track your sleep. We set you up with a nutrition coach. We have you do a diagnostic on your entire body, mind, and spirit, so that you don't get to that point where it's too late and you're doing triage in an emergency room, right?
So when you're giving a survey to get an idea of their overall well-being, and you talked a little bit about analytics and tracking their progress, how do you even do that?
So we start with 3 things, really 4, but the main things is a brain map. We pair with Dr. Licata over at Vital Head and Spine, and we have their brain mapped. We have them understand what's going on in the wiring of their brain. That's going to tell us a lot about what's going on in the rest of the body. And then we have them do a spinal exam, we have them do a full blood panel, and we have them do a metabolic analysis. And then another assessment that I have done is we send them to a therapist who looks at their emotional well-being. And in that session alone, they're going to find out what's really going on. And then that therapist is well versed enough to tie certain things to the body. So for me, for example, my chronic neck pain was tied to not feeling emotionally supported throughout my life. And we unrooted some of that stuff that came from childhood that I'd been carrying my entire life. And it wasn't until I was willing to go consistently to the therapy and begin to talk through some of that stuff and let it go. But this particular therapist also does somatic therapy. He works on the body. He uses tuning forks and sound bowls and healing mechanisms that helps move some of that tension and energy and helps release that. And within months, I was feeling much better. To this day, I have not had any neck pain at all.
Wow.
And I wish I had started sooner, but I had gotten to the point where I felt like I was going to pass out because the pain was so bad. I could barely turn my neck. And so at that point, you go to the doctor, and then of course they're going to give you the powerful opioids and medication that says, hey, this will give you some relief. But
yeah, because I think I didn't even know that was an option.
Yeah,
it's like good thing you're here to kind of tell me about it, because it's like it. Now that I can think back to the thousands of patients that I've seen, it's just like certain ones are coming to mind. I'm like, there were other things going on that, one, I didn't understand, but two, I couldn't necessarily help, but three, I didn't know who to go to.
Right.
And I think that is the beauty of like having Dr. Lacotte and yourself, and having this network of professionals that we can turn to, and realizing there are times where we're out of our scopes.
Yeah.
You know, I think that's a key part. So overall, your experience, was it worth the time and the money?
Yes, of course.
Where do you think you would be, like, if you didn't meet Chris, how many months ago was it?
2 months.
Okay, in 2 months, it seems like a lot has happened.
There's a lot.
If you didn't meet Chris 2 months ago, where do you think you would be now?
Still just stuck, just miserable, maintaining. I feel like I've always, like I said before, have an open mind, so I would be searching and be wasting money on this and that and just getting more hopeless because I'm exhausting all these avenues and none of them are really working. You know, it takes a toll on you.
And then after this entire experience, what would you say is your number one most important takeaway?
Hope.
And have people we can rely on.
Yeah.
Yeah.
There is hope. A lot of people are struggling with so many issues. The pandemic has really brought a lot of that stuff to light. They've been suffering in silence. And now they're not able to function as well as they thought. Maybe some people have been forced to work from home. Injuries are coming up more prevalently, and then there's the mental health issues that people are dealing with, the anxiety, depression, suicidal ideations. I'm seeing so much of that right now, and it's challenging to find the right avenue to get help through. But Wellness District is here as a community to support you.
Right.
And that's the biggest thing, is if you don't do any of our services, just know you have a community of people that will listen and talk to you and support you no matter what.
So if people want to find out more about Wellness District, how do they do that?
Yeah, you can go to our website, wellnessdistrictla.com, or you can find us on Instagram at wellnessdistrictla.
And then Paul, how about your group and your soccer stuff, your nonprofit? Tell us a little bit more how people can learn about that and how to support you as you help the youth in our community.
You can email me. Yeah.
What's your email, so everyone knows?
PablitoLedoux@yahoo.com.
Yeah, I think it's important that we had spoken at length about it before, but how you're helping the youth, because they are our future, and to impart them on, you said hope, and a lot of, I have 2 young kids myself, so it's like some kids that aren't as fortunate as my kids, I can only imagine the struggles and the hardships that they are going through, especially right now in the pandemic. Do you have to learn from home? Is there support? Is there this and that? So it's very important to give back and help those that may not have the help, to have that hope.
Yeah.
Yeah, and that's what I love about what Paul does.
Yeah.
Going to people's homes. The parents said, hey, we need to get our kids outside to exercise, and he'll come teach them soccer lessons and get them moving again and get them excited about life again. And he just has that energy and charisma about him. And now he's doing a little bit more coaching and helping more parents. And I love the movement that he has started. And I think helping people realize that there are people like Paul out there that are willing to come and help you is a huge, huge blessing.
All right. Well, awesome. I appreciate Chris and Paul joining us here at HealthFit on day before Christmas Eve.
Yeah.
I thought that was really important to have this chat. But again, thank you, Chris and Paul, and we'll see you next time.